story. Dr. Jesse Papenburg is a pediatric infectious disease specialist and a medical microbiologist at Montreal's well-known children's hospital. Good to see you, Dr. Papenburg. Appreciate your time.
Thanks for having me, Todd.
The takeaway of those 3 children who've died, what do people need to know?
Well, obviously, it's a tragedy anytime a child dies in Canada of a potentially vaccine-preventable disease. And my heart goes out to the families. But unfortunately, year in, year out, we do see deaths associated to influenza in our pediatric population in Canada. And it remains a relatively infrequent event. We're talking somewhere along the lines of 5 to 10 cases per year. But we do see it. And what we know is that there are certain groups that are disproportionately affected by severe influenza among children. So children with underlying medical conditions represent 75% of pediatric deaths associated with influenza, and children under 5 are also disproportionately affected, representing over half of these mortality cases. And these are data from nationwide surveillance conducted by a group that did surveillance over 20 years. So I think that the key point here is that even though influenza vaccine, we know that it varies from one year to next in terms of how effective it is. But if you average it out over several years, it reduces in kids the risk of having to go to an emergency room, be hospitalized, or even die from influenza by roughly 50%. 50% is not perfect, but reducing your risk by half is substantial, and that's why we are encouraging families to get that protection this year.
Yeah, I was going to ask you for your advice for parents who are watching.
Right. So this year, what's remarkable is even though it's quite common to have school-age kids kind of ahead of the curve in terms of increased transmission early on in the influenza season, what we're seeing in Ontario is over 60% of all tests being done for influenza among school-age kids are coming back positive. That is a sky-high positivity rate. So there's a lot of transmission going on right now, particularly among the school-age population. But thankfully, school-age kids do have a relatively low risk of running into severe disease, like getting hospitalized due to influenza. And what we're seeing is that the elderly, 65 and above, and as well as kids that are under 5, those are the 2 groups that are having the most hospitalizations right now in Canada. So a lot of flu going around school-age kids right now. Yes, there are severe outcomes just because there are so many infections due to influenza in school-age kids. But our most vulnerable populations remain at the extremes of age, the elderly and the very young, as well as people with underlying medical conditions, whether they be adult or children. Pregnant persons, we encourage them to get vaccinated because pregnancy is a high-risk state. And by vaccinating during pregnancy, we actually have a passive transfer of antibodies for the newborn during those first 6 months of life when they're very vulnerable to the severe influenza infection, but are too young to get vaccinated because they're only eligible as of 6 months of age when their immune system is able to respond properly to the vaccine. So we really want to see increased vaccination rates overall, but most importantly amongst our high-risk populations, because they're the ones who are going to benefit the most.
Dr. Jesse Papenburg joining us from Montreal. He's with the Montreal Children's Hospital, an infectious disease expert focusing on pediatrics. Good to see you, Dr. Papenburg, as always. Thank you for this today.
My pleasure.